Thank you, Mr. Williams, and a pleasant good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Center Situation Report for Wednesday, July the 29th, 2020. Now, as at last Friday, July the 24th, the World Health Organization reported the largest single-day increase in the number of cases since the pandemic started at the beginning of this year. So last Friday, we saw an increase in the number of cases. The increase was as much as 284,000 cases in just 24 hours. Now, the biggest increases were seen in the United States of America, Brazil, India, and South Africa. As at today, July the 29th, the total number of confirmed cases of COVID-19 is now over 16,500,000 cases. If you were to calculate the difference between last Wednesday to this week Wednesday, there is an increase of 2 million. Yeah? So today, 16,500,000. Last week, it was 14,500,000. In terms of the death toll is now at 656,093 cases. What's happening in the United States of America? As at today, the number of cases, 4,380,871 confirmed cases of COVID-19. In terms of the death toll, it's over 149,000 cases. What's happening in the Caribbean region? Well, as at the last situation report coming out of the Caribbean Public Health Agency, the total number of confirmed cases is now over 100,000. So the 100,000 mark has been passed. In terms of recoveries, 44,298 recoveries, and the death toll is 1,705 as at July the 27th. Now, this is good. This is good news for the Caribbean region, because if you were to calculate the death rate or the fatality rate within the Caribbean region, it's at about 1.7, and that is a little lower than the global or international rate. And I hope that this trend continues. Now, based on the latest report coming out of CAFA, the report states that the risk of further cases occurring in the Caribbean area continues to be very high. What's happening in St. Kitts and Nevis? To date, we have tested over 1,000 persons. So as at today, 1,006 persons have been tested, and so this is good. To date, we've tested all those persons who were suspected of having COVID-19 along with their contacts. And so the number tested, 1,006 persons to date. In terms of quarantine, at present, we have 50 persons at government-designated facilities, and we have 1 person in isolation. In terms of returning nationals, we continue to accept our nationals who have requested to repatriation. And so at present, we have 51 nationals in quarantine, 35 in St. Kitts and 16 in Nevis. Between April the 24th to today, July the 29th, a total of 145 nationals have returned to the Federation in the context of COVID-19, 93 females and 52 males. This afternoon I have good news, all right? And so we have 16 of our cases have now recovered. We only have 1 active case at present. And so I repeat, 16 of our cases have recovered, and we only have one active case. The patient continues to do well and is stable, recovering nicely. Now, this afternoon, I want to spend some time talking a little bit about living with diabetes in the context of COVID-19. And so I want to reach out to those persons who are diagnosed with diabetes mellitus and what it is you need to know in terms of what are the recommendations you need to follow in the context of COVID-19. And now I'm going to share with you the latest evidence or information coming out of an article that was published in The Lancet, a renowned medical journal, as late as July 17th earlier this month. It was entitled COVID-19 in People with Diabetes, Understanding the Reasons for Worse Outcomes. And so basically, the scientists, they looked at some patients with COVID-19 in China, in Wuhan, 1,561 patients who were diagnosed with COVID-19 at a hospital in Wuhan, and they found that those with diabetes were more likely to require admission to the intensive care unit. Another set of scientists, they look at a cohort of in-hospital patients with COVID-19 in the United Kingdom, as many as 5,693 patients. And they found that the risk of death were more common in those with uncontrolled diabetes. All right? And so let's talk about diabetes in general. I think we are all aware of one fact, that diabetes is known to confer or result in an increased risk of admissions to hospital for infections like respiratory tract infections. And so diabetics in general, they have an increased risk of picking up infections. And so it's not unusual for a diabetic to be admitted for a respiratory tract infection. And also, they looked back at what transpired in the SARS outbreak, the MERS outbreak, and the H1N1 flu outbreak. And they found that diabetics had an increased risk of picking up these infections. However, what is the science telling us now about diabetes and COVID-19? Well, this latest journal article, what it is really saying is that this does not seem to be the case for COVID-19. So in other words, they are finding out that diabetes does not really increase the risk of you picking up or contracted COVID-19. Diabetes, however, is more frequent in patients with COVID-19. In other words, if you contract COVID-19 and have diabetes, the risk of you developing the severe form of COVID-19 is increased. So the disease does not increase your risk of picking up COVID. However, if you are a diabetic and pick it up, the chance of you developing the severe form of the disease requiring hospitalization is increased. And so patients with COVID-19 and diabetes have a worse prognosis. So that is what the article or the science is telling us. Patients with COVID-19 and diabetes have a worse prognosis, most probably because of concurring effects of multiple factors, because of other factors. And these factors include age, poor blood sugar control, and the presence of other chronic conditions. So in other words, if you have COVID-19 and diabetes and you are over 60, your outcome will be poorer. If you have COVID-19, diabetes, and your blood sugar values are not controlled, your outcome would be poorer. Yes? So poor glycemic control or poor blood sugar poor control of your blood sugar values before hospital admission and during your hospital stay will worsen your outcome if you do get COVID-19. So in other words, if you are diabetic, it is very important that you control your blood sugar values. So that's the biggest takeaway message. If you have diabetes, in the context of COVID-19, the most important thing you need to do is to get a handle of your blood sugar values. You need to really manage your blood sugar levels and get your blood sugar values down to their normal levels. The other factor is that patients with COVID-19 and diabetes have a greater prevalence of other chronic illnesses like heart disease, stroke, and kidney disease. Actually, those countries, China, Europe, United States, what they are finding is that if you have COVID-19 and diabetes and poor or impaired kidney function, your prognosis is poor. Yes? And so these are the recommendations for persons living with diabetes in the context of COVID-19. 1, we recommend strongly that you maintain good glycemic control. In other words, we want you to maintain blood sugar values that are normal. We want you to monitor your blood sugar values on a regular basis. Secondly, we ask that you take your blood sugar medication as prescribed. So we want you to be compliant with your prescription medication. If you have other chronic medical conditions like hypertension, heart disease, kidney disease, we want you to be compliant with all your prescribed medications. Adhere to your prescribed diet, eating fruits and vegetables, and we want you to exercise regularly because the appropriate diet and exercise will help you to gain good control of your blood sugar values. We want you to boost your own immune system, get adequate rest, keep well hydrated by drinking the good old plain water, get adequate sunlight, and take your multivitamins and supplements. If you are living with diabetes, you must protect yourself from the new coronavirus. Always wear your face mask when in public spaces. Practice good hand hygiene. In terms of physical distancing, ensure that you maintain adequate distance between yourselves and others, at least 3 to 6 feet away from others. And avoid social gatherings. Avoid mass gatherings where you have a lot of people gathered together. So in summary, diabetes does not seem to increase the risk of your contracting COVID-19. However, older persons with COVID-19, diabetes, and other chronic medical conditions seem to have a worse prognosis. And so we recommend that if you are living with diabetes at this time, the main thing you need to remember is to maintain good blood sugar control. Maintain good glycemic control. Monitor your blood sugar values. Make sure they are normal. And boost your immune system. Thank you.